Hello, and thank you for joining us. I am Jasmine Navarez, Digital Content Coordinator at Simulations Plus. I'll be hosting today's webinar behind the scenes, making sure we don't have any technical difficulties. In this webinar, John DeBella, President, PBPK Solutions at Cheminformatics, Neil Miller, Vice President, Simulation Sciences, and Vera Lukachova, Chief Science Officer, will walk you through GPX, the next level PBPK PBBM platform launching today. They will demonstrate how you can leverage the new intuitive interface, enhance data management, and streamlined workflows, and show you how GPX is able to process your simulations faster than ever before. Peter Kilford, our Associate Vice President of Software Business Development, will serve as our moderator today. A few housekeeping items before we begin. We take your privacy rights seriously. By registering for and attending this event or participating in the Q&A session, you are allowing us to contact you for follow-up. You may ask questions via the questions panel on your dashboard at any time. If you need assistance, please use the hand raise icon, and we'll address all questions in the Q&A after the presentation. And I'll pass things over to Peter.
Thanks, Jasmine. So welcome all to the webinar today for an exciting day for Simulations Plus as we release the new version of GastroPlus GPX. I'm delighted to introduce our speakers today. We have John DeBella, who's president of our PBK and Cheminformatics Solutions business units. John joined the company in 2003, spending time working on the development of GastroPlus and DDE Plus software and working on a number of consulting projects. He now leads the two business units while continuing to train a host of users across the world. Vera Lukachova is the Chief Science Officer at Simulations Plus. She's been with the company for around 15 years, working on GastroPlus and many other products, as well as contributing to modeling studies, helping companies with their drug development programs in different stages of the drug development process. She's also had many interactions with the different regulatory agencies across the world. And also like to introduce Neil Miller, who's Vice President of Simulation Sciences at Simulations Plus. Neil has been driving the development and application of PBK modeling software tools for pharmaceutical, biotechnology, chemicals, and the consumer goods industries whilst working at Simulations Plus. And Neil's been leading the team that's been developing GPX, driving the concepts and the design to ensure that the science you all know and love is present in the next generation of our software. So without further delay, I'll pass over to John now to introduce you all to GPX.
Well, thank you very much, Peter. Good afternoon, good morning, everybody. Thank you for carving out time for us today to share in the excitement of the release of the GastroPlus X, or branded as GPX, software environment. I want to start with a little bit of a story. So 9,450 days ago, a ragtag team of brilliant and motivated scientists based out of a small office in Lancaster, California, which is just outside of Hollywood, had a vision. Can we apply modeling and simulation technologies, which have been utilized for decades in many industries, to support research and development in the pharmaceutical and biotech markets? On July 1st, 1998, 9,450 days ago, GastroPlus 1.0 was released. Now, like any good Hollywood story, there were many twists and turns, especially in the beginning. Would it be possible for us to really model with confidence all of the different biological, chemical, physical processes that are occurring in animals or humans? In the beginning, as we were traveling around and making presentations, showing what it was that we had developed, we were met with some skepticism, but there were some early adopters. And through determination and a laser-like focus on science and innovation, traveling the globe to spread the gospel and form close relationships and partnerships, here we are today. And where we are today with GastroPlus is pretty impressive. So over the course of the last 9,450 days, we have over 200 companies globally that are using GastroPlus on a daily basis in all types of industries: pharmaceutical, biotech, generics, chemicals, cosmetics, consumer goods, and more. We've been really able to form close relationships, strategic partnerships with regulatory agencies and health authorities. And there are many, many reviewers that are now trained on the use of GastroPlus and are waiting for companies to submit their models to help support regulatory interactions. 9,450 days ago, I'm not sure we thought that the use of GastroPlus would be used to support a regulatory decision. But since 2020, there have been over 70 such regulatory success stories. GastroPlus has been cited over 3,000 times in peer-reviewed journal articles, in conference presentations, referencing different applications of GastroPlus, from discovery going all the way through to clinical development. And today, we support over 350 universities globally by providing access and learning materials to professors and students to help train the next generation of scientists. And it was in the spirit of trying to think about how is it that we were going to support the next gen of scientists for the next 25 years, where we were able to develop the next generation platform, GastroPlus X. So for the past several years, we've been invested in the development of a software environment that would support the global growing user community. With GastroPlus X, we've been focused on improving the overall user experience, being very thoughtful about how is it that we could design an environment that would follow our customers' research and development processes and not force or require them to fit their processes to our software. As you'll see in the demonstrations and during the course of this webinar, there are 4 major themes or areas that we have heavily invested in over the course of these past several years: model flexibility and reusability, software engineering, visualization and analytics, and data management. All with the goal of trying to not only make it faster and easier to onboard new scientists to the world of PBPK modeling, but to also make it a lot easier to be able to communicate the results that are being generated internally to help accelerate R&D decisions, and externally to regulatory bodies to accelerate the regulatory submission process. And I would just like to end here by saying that this release is not just a milestone for our company, but a real testament to the effort, the sweat, the tears that have been spilled by our village, by the village of developers, of scientists, of testers, trainers, writers, marketers, salespeople, project managers, and leaders over the past several years. We did it. The enthusiasm is infectious. We are proud of what it is that we've accomplished, and we're really excited to get this into your hands to help you do what you do best: improve global health through the development of innovative products. And so what I'd like to do now is turn things over to Neil to give you a preview of the GPX environment, taking you through the user experience, the user interface, and really highlighting a lot of key applications that hopefully you'll start realizing in the very near future. Neil?
Thank you, John. GPX is intuitively designed and therefore logical and easy to use. Modeling in GPX is a customized and personal experience that is efficient, powerful, and provides thinking scientists with the platform to add value and make critical decisions for the projects they work on. Will you choose the light theme? Or will you choose the dark theme? And what will be your favorite and most valuable inbuilt key view plot? First, let's focus on the new GPX paradigm. The dashboard view is for GPX project management and gives you the power to supercharge your modeling via templates, more on that in a bit, and it also allows you to asset, export and import run, simulation or smaller assets for use in other GPX projects in a once and done efficient modeling paradigm. The observed data view is the home to experimental profiles and pharmacokinetic parameters. Select your data type and then add your group name, and then you can add multiple series of the desired measurement type. Here we have exposure data, where we have profiles of concentration in plasma versus time following oral dosing. We could have also added dissolution profiles, solubility profiles, and many more data types, all within the observed data view. The dashboard and observed data views are the foundation for the new efficient data management paradigm that is at the heart of GPX. The key word is reuse, as assets such as simulations can be reused across projects via the dashboard, and experimental data can be reused within projects via observed data. The compounds view allows you to assess compound properties. Data are logically grouped together, and the optimal amount of information is displayed on the screen to maintain focus and avoid information overload. Let's expand the solubility panel, where we can see the reference solubility for form 1. You can have multiple forms within GPX, and then we'll expand the biorelevant in vitro solubilities sub-panel. So we're seeing all of the solubility displayed on the graphical user interface together. GPX is designed around a logical, vertical workflow. First, you would do your exploratory data analysis in observed data. Then once you have a compound, you would formulate it, then dose it to a physiology, and then how the body handles the drug, namely the pharmacokinetics, come into play. So the navigation pane logically flows from compounds to dosing to physiologies to pharmacokinetics. The physiology schedules view is for more complex food effect modeling, disease progression, or maturation of pediatric subjects as they grow. The simulations view is where you combine the reusable assets required for simulations. The runs view is where simulations are used for batch simulations, parameter sensitivity analysis, population simulations, optimization, or virtual bioequivalence. Analysis is where you gain a deep understanding of your simulations and runs. Labbook allows you to document your model building and simulation findings. GPX has interactive diagrams where you can assess key input parameters or make critical modifications. Let's take a look at the PBPK Plus diagram. So we will expand the PBPK Plus panel within the pharmacokinetics view. And then if we right click on a tissue, we can see we can change the tissue type. If we were to left click on another tissue, then the sub-panels on the right hand side would change to reflect the physiology of the tissue that you just selected. You can supercharge your PBPK or PBBM modeling with GPX by using templates when creating new projects. Templates allow you to create projects with only the assets that you need for your specific modeling project. So GPX projects are faster to create, are optimized for asset efficiency, and they require less checking. To use a template, click on the icon next to New under Create on the GPX dashboard view. Enter your project name. Then browse to a project location. Set the From Template toggle to On. Select your customized template from the list, and then simply click on Create, and you are good to go. The template I created here contains only the formulations, dosing schedules, and physiologies that I need. I'm now ready to import a structure and begin my modeling journey with a QSPR plus PBPK assessment of my compound. The combination of artificial intelligence, machine learning, quantitative structure property relationships models with physiologically based pharmacokinetic models is an essential first step in mechanistic modeling, as it provides insights into compound properties and the timely definition of the essential value-added experiments. So I now click on Compounds in the navigation pane, and then click on the AIML ADMET Predictor Import button. I then click on Select File to navigate to my compound structure. Open the file. I then select the required dosing schedule and physiology schedule and specify the required pharmacokinetic model. And then I click on Start Import. The ADMET Predictor module in GPX automatically creates simulations as specified by you. So when the import is complete, simply go to the Simulations view and run the simulation. GPX is the Thinking Scientists PBPK PBBM platform, and the inbuilt plotting in the key view gives you a critical ADME understanding of your compound. So spin through the 5 key view plots. The CP time plot, you can assess the shape of the curve. Move to the absorption and dissolution plot to see whether solubility or permeability are limiting absorption. Is there any precipitation? And how much first pass extraction is there? Then move to the regional absorption plot, which is an in vivo microscope giving insight to the main absorption windows in the gastrointestinal tract. Then you have the systemic distribution plot that highlights any tissue sequestration. And finally, you have the elimination plot that details the fate of the compound. The inbuilt key view plots are colored for easy recognition of the processes, and you will soon know the color scheme off by heart. But when you are new to GPX, it is very easy to decipher the plots. Let's go back to the systemic distribution plot, click on the pink curve, expand the plot settings, and then hover over the highlighted curve to see that it reflects adipose. You can customize the name, and then you can choose to display the legend on the plot. You could then right click on the plot and then copy the image, and it is then ready to be pasted into a report. If you want to go deeper, then switch the mode in analysis to deep view. Type in a search term. This helps to identify the curves you're looking for, or you could use the tree hierarchy, and then select curves that you wish to plot. and then select the state variable. You can use the mouse to resize the plot or drag the plot around. You could expand the additional features panel and then select color by random to quickly recolor the curves. If you don't like the colors, click again, and then there'll be a different selection of random colors. If you want to change the formatting, you would highlight the curves that you wish to change the formatting for, and then in the plot options, adjust the formatting. So here we'll increase the width of each line from 2 to 4. At this point, we could navigate to the lab book, and we could actually pop the lab book out and then potentially move that to another monitor. And we could then make notes about our findings and decisions as we progress through the modeling. So here, if we select the simulation that we've just run, the simulation for drug, and then we could put in the notes that the QSPR plus PBPK has identified that a significant amount of the compound distributes to the adipose. Now let's look at the power of GPX. First, we will run a batch simulation and look at multiple simulations simultaneously in the graphical user interface. So we go to Runs, and we select the batch simulation here, which has 3 simulations in it, and then click on Start. Once the run has completed, the analysis window will appear, and the simulated data are shown as the solid lines and the observed data are the circles. The initial color for the CP versus time profiles in GPX is blue as per historical GastroPlus. We can see from the plot here that the elimination is underpredicted as we have not yet included the enzyme kinetic data we have available for this compound. To include enzyme kinetic data, you can use the metabolism and transport module, but first you must add the required enzymes in the enzyme kinetics panel in the compounds view. So let's go to the metabolism and transport module in the modules pane, and then we will select the appropriate compound, select the appropriate physiology, select the appropriate assay type, and in vitro fraction unbound. Then we open the scaling factors panel and select the desired tissue weight source. Then we expand the metabolism panel, and then the Michaelis-Menten kinetics subpanel. First, we should check if the units are correct. We want nanomoles per minute per mg, so they're correct. And then we enter the value. So it's 0.85 for the Vmax, and the Km is 3.7 micromolar. Once the values have been entered, we then click on Transfer, and the values will be transferred to the compounds view. We can click on the message in the message center, which will navigate to the compounds view. Then we can select the appropriate compound and see that the enzyme kinetic data have been transferred. So we can now click on Done in the message. So if we now go back to Runs and rerun the batch simulation, we will notice much better predictions of the concentration of plasma with respect to time. And if we expand the additional features panel and then switch to color by simulation and then click color by, the simulations and the observed data are recolored. Now let's create a simulation in a different population. So we go to Physiologies and then click on Add. And then we'll type in the name of the population, Japanese, and we will select a 30-year-old individual. So we'll click on OK. And then we will select the required population. The age is as we want it, 30, so we'll now expand the population estimates for age-related physiology panel. And the physiomolecular window will pop up to allow us to select the appropriate blood to plasma ratio and fraction unbound in plasma. So we will select the 30-year-old, 73 kilogram, click select, and then create the pair physiology. We now go to simulations, and we can select a simulation. So we'll select the 7.5 mg. We will copy that simulation and change human to Japanese, then click on OK. And then in the drug administration panel, we'll switch the physiology schedule to Japanese. A message pops up in the message center to say we should consider recalculating the liver first pass extraction. That's for a compartmental model, so we'll click on Done there. And now we'll go to Runs. And actually, before we go to Runs, we'll go back to Simulations, go into the compound settings, and deselect the observed data because they're not for the Japanese population. So we'll set this to none. And we'll go to Runs, and we'll add a new batch simulation. And this time we'll call this American and Japanese. And then select the 7.5 mg American, 7.5 mg Japanese, minimize output settings, and then click on Start. When the simulation is complete, we can click on the curve here to see. Let's minimize additional features, expand the plot settings, and hover over to see that the exposure is predicted to be higher in the Japanese population. Now let's run a population simulation for the American population. So within Runs, we will click on Add and then select a population simulation. And we can put American Pop Sim. And then select a simulation. And then specify the number of subjects, the population size. We will choose to update the KP values. And then we'll minimize the simulation settings and the output settings, and then click on Start. The run controls will give you a progress update on the population simulation. And when the population simulation is complete, the program will navigate to the analysis view, but this time it will navigate to the population view. Within analysis, you can switch from the population view to the summary view, and we will uncheck observed data so we can see all of the parameters for the individual subjects. If we expand the statistics panel, we can see the statistics, and if we switch to the key view mode, we will then see the individual subjects' CP time profiles. Let's now run a DDI, but first we will go back to the dashboard to import the simulations for multiple perpetrators from another project. So on dashboard, we would then select import, and then we would browse to where we have got the project with the perpetrators in. So we'll select fluconazole and ketoconazole, click on open, check that the import all toggle is on, and then click on import. Once the import is complete, we can click on OK on the message, and now we can go to the DDI module. So we'll expand the configuration panel, we'll select the required physiology, we will select dynamic as the prediction type, we'll leave it for single simulation. In victims, we will select our drug compound, but we'll also select ketoconazole, and we will close or minimize the victims panel, go to perpetrators, and then select fluconazole, and then ketoconazole, and then scroll down to the perpetration parameters table, and here we will select the inhibition constants that we want, so the one for fluconazole and then the one for ketoconazole, and then expand the run panel, and click on check warnings just to see if there are any issues with the simulation. And here we've got a warning to let us know that we're using an in vivo perpetration parameter. So that's the value, the Ki that we're using for fluconazole. It's in vivo. So we can click done on the message. I should point out that we would normally use an in vitro unbound value or a total value with conversion through the in vitro fraction unbound. But here I simply wanted to show you the messages center in action. And then we can click on the dynamic baseline simulation. Once the simulation is complete, the results panel will expand so we can look at the calculated outputs for the baseline simulation, and then we can click on the dynamic full simulation button. And when the simulation is complete, we can look at the dynamic DDI ratios table, which is color coded to let us know that there's a significant interaction for our drug in terms of AUC, moderate for Cmax, and then a minor interaction for ketoconazole. After reviewing the ratios, we would recommend assessing the CP time profiles in the analysis view. Here we have the dynamic full simulation with the 3 compounds. Note that we are predicting single doses here rather than the more typical and longer repeat dose simulations. We can select the baseline simulation and then via additional features, color by compound. Also run population simulations in DDI. So if we go back up in the DDI module to the configuration panel and select population simulation, and then scroll back down, the population settings panel will now be active. So we'll expand that panel and set the trial size, set that to 6. We'll update the KPs. And then run the population simulation. The run controls panel will appear to give you a progress update on the population simulation within the DDI module. And when the population simulation is complete, you can scroll down and look at the predicted ratios for each compound via selecting the compound in the drop-down selector. Finally, don't worry about not being able to use historical GastroPlus Visual Basic databases in the new project paradigm. The legacy import functionality allows you to import your current databases and use them in GPX. The science in GPX is the same as that of previous versions of GastroPlus that has been extensively verified over the last 25 years. The ultimate test that GPX gives the same results would be to load in the simulated CP time profile from the original Visual Basic database into GPX and link it with the same GPX simulation. So let's go to the Graph tab, then copy the data, copy data to clipboard, and then paste into Excel. And then copy that data, Control C, making a note of the units. So the units are micrograms per mil. So we'll then go into GPX, into the observed data view, and then we will add an exposure data group. So we'll add, and then we'll call it furosemide. And then with the measurement type set to concentration, click on add, and then we'll say Visual Basic CP versus time. Click on OK. Change the units to microgram per mil. Paste in the data. And then scroll down in GPX to map the data. So that's systemic concentration. And then go to the simulation for furosemide, expand compound settings, scroll down to observe data, select the furosemide, and then run the simulation. Once the simulation is complete, GPX will default to the CP time view, and we can see a perfect match in the simulation from GPX to the original Visual Basic GastroPlus simulation.
Thank you very much, Neil, for the demonstration of GPX and the power that you can all experience when moving to the new platform. I know a few of you have been using the Q&A box. Please do feel free to ask any questions that you have and type it into the Q&A box, and we shall answer those in a short while. Neil, John, and Vieira are present on the call, so we're happy to take questions. Before we get to that, though, I just wanted to highlight a few other pieces of information for you that's linked to GastroPlus or GPX coming out. We're very well aware that many of you are used to using our the historical version of GastroPlus, the Visual Basic version, as Neil called it in that demonstration. And there's going to be a time to switch over to GPX, and we're pleased to be able to tell you that we have a number of opportunities to support you as you transition to GPX, whether you're swapping to the new platform or are new into it completely. We've got a number of complimentary workshops. They run monthly, and they are now going to be all in GPX, starting from, I believe, June 4th, and then once a month after that, which you're invited to join and can register for on our events page. We also have a GPX immersive experience in July, which you're able to register for. That's going to be happening a few hours each day for the whole week, and that's a virtual experience. And we are having a full in-person introductory workshop to GPX in September, which please do take a look if you're able to join us for that and would like to. That's details are on our website. And there'll also be a rerun of that, but as a virtual offering in the fall. We've got a number of offerings as well where we're doing some workshops prior to some of the conferences coming up. We have one in a couple coming up in Europe prior to the PAGE meeting in Rome and prior to the GMP meeting in Lyon, France. So again, if you're going to be attending those, then please do look to see whether you can join us for the pre-conference workshops. And there's going to be a lot more discussed around the training opportunities, not just these that I've shown here, but also the other opportunities you'll have to interact with our team, both in person at sort of these offerings, but also with some other drop-in sessions that we're providing in the coming months to really support your transition to GPX. And finally, we also have a further webinar coming up tomorrow, in fact, which looks at demystifying GPX implementation. So if you have any questions around how do you get GPX, what do you need on your PC to be able to get GPX installed and start using it now, please do join us for this webinar where we'll have expert insights and practical tips for you to be able to get access to GPX as from in a few hours' time, in fact, today. So thanks for those that have submitted questions already. We shall start with some of those for the panel that's on. So the first one we've got is we saw some of the speed of GPX with Neil doing the demo, but what improvements have you seen, I guess, in testing in the speed performance compared to the legacy GastroPlus version?
We have seen quite a bit of improvement. I don't want to put exact number on it because it depends on the setting, what simulation you are running, but just about every simulation that we've completed runs faster. Some of them will be much, much faster than the current version.
Thanks, Viera. There's a question here, will current license holders get GPX automatically?
I guess you already provided answer to that question a little bit earlier. There will be details tomorrow during the webinar or discussing the details, but the short answer to that question is yes. The GPX works with the same licenses as you have right now. So after it is installed, you will be able to run GPX the same way as you are running the current version.
Yeah, there was another question on speed actually that's just come in around DDIs, saying that in classic GastroPlus that a multi-dose DDI could take hours. Do you have any comments on the expected increase in speed? I guess you've touched on that already, Viera. We maybe don't want to comment on numbers, but whether you want to make a comment on improvement for DDIs.
Again, it is going to depend heavily on the type of model that you have, how long the simulation runs, what are the settings, and so on. I would expect that it will be far bigger improvement than just 50%. We've seen several fold improvements, increases in the speed of the simulations so far.
Thanks, Viera. Maybe one for Neil. There's a question about was it possible to include legends on the simulation outputs or the plots with GPX?
Absolutely. You saw briefly excuse me, in the demo, I put adipose on that plot, but you could have whatever curve you've got, you can add a legend to that. And what's really nice is we're working out the most efficient workflows is that if you kind of select all of them to display and then you unselect them in the tree, then the plot will visually and dynamically update. I didn't show it in that demo. There is also the ability, like in the current version, to have the AUC, the Tmax and the Cmax displayed on the plot. And I can see another question we've got, what can be done in GPX, and we'll elaborate that can't be done in 9.9. You can do the multiple simulations, so you can have multiple outputs on there. Obviously, if you have many, it might then get a little bit busy, but there's a lot more that you can do around the plotting. So the first question, yes, you can have the legend, customize it, change the names, and you can also have the outputs on the plots as well.
Thanks, Neil. And I guess to follow up on that, there was a question on how often we'll be looking to provide upgrades, updates to GPX, and what does that also mean for legacy or classic version of GastroPlus as well?
Neil, did you want to take that one?
Yeah, sure, I'll take that one. So we're looking to get on a yearly release cycle. So we're hoping to have new versions of GastroPlus coming out every year, and we are in the process of defining and determining what functionality will be in the next version. So some of the questions that we've got on here will feed into that. In terms of the Visual Basic, so in the next couple of rounds, we would imagine that then they would be completely aligned, GPX with Visual Basic. So the first version of GPX, for example, doesn't have additional dosage routes in. So in a couple of versions, we will align those, but there shouldn't be any more Visual individual basic versions released, they will be GPX and they'll be fully aligned. But as you've seen from the demo, the science is the same. So what science is in there, we're getting a perfect match with those simulations. So yearly release cycle is what we're aiming for going forward. But we want your input. So I can see we've got a question about lymphatic absorption, and that might tee Viera up to answer that question. But please feed back to us is what's most impactful for your modeling. I think that links to kind of the first poll question as well. We really want to hear feedback from you so we can give you what you need in the versions that are coming out soon.
Yes, so there was a question on lymphatic absorbed drugs and can that be simulated in GPX? Sounds like that might be a future improvement that we will take note of, but I don't know if there's any comments on that in addition, Viera.
I think Neil already answered that one. It is not yet. It is one of the items that we are trying to prioritize right now for the subsequent versions. So it will be coming at some point. We're just working on the priorities at the moment.
And I guess one that links through to, you showed the metabolism and transport module, Neil. There was a question about whether you can import specific enzymes that people are working on or targeting. I have, for instance, BTK or TEC. But is that a possibility to import user-specific enzymes?
So you can add custom enzymes if you're looking at from terms of metabolism, but I was wondering whether that was aimed more at the pharmacodynamics. So we've got the PD Plus module in as well, with the PD models that were in the legacy GastroPlus versions. So if it's from PK/PD, yes, you've got the PD Plus module, and if you actually want to incorporate specific enzymes, you can do that in the enzyme kinetics panel in the compounds view in terms of the metabolism and potential DDIs.
A couple of questions come in. I can maybe take some of these around licensing. So GPX is licensed in a very similar way to originally you'll have seen GastroPlus, where it is modular. So there was a question about whether DDI and PBPK are add-ons. Yes, they are still modules, as you saw on the right-hand pane. So if you don't have licenses, they will be not sort of lit up like in green like Neil had them. But we're happy to look at opportunities for you to use those if you're interested in adding those to any licenses that you have. And to answer another question, yes, you can have GastroPlus 9.9 and GPX on your system, and you can run them both in parallel. You'll be able to, with your license, you'll be able to point to assuming you have one user license, you'll be able to point to one or the other and start using them side by side. More questions on speed. Everyone wants to know about the speed, I think. Good to know. It is faster, I think. So a question here about how would you recommend start working with GPX? Would you recommend starting a project from scratch or in importing an old model and learning from how the data was integrated? I guess that's a very good question, actually.
No, that's a great question, and I'll take that one. So my personal recommendation would be to start from GPX from scratch. So you would build it up and you would get a real sense for the assets and the reusability of the assets. And I should say that we've been working hard to add many tutorials to the already extensive list to really introduce you seamlessly into the new paradigm. So I'd suggest creating a project from scratch, because that really does, as I said in the demonstration, give you the efficient project. Because what we've seen, we've done a beta or beta testing, and people are really excited by the lack of the reduction in the amount of checking they're going to have to do, and they're not going to have to look through drug tables and drug records. You'll have one formulation, you can reuse that in dosing schedules, for example. So I would definitely say start from scratch to understand the assets, and then once you've got a feel for the paradigm, then bring in a legacy import database. You're going to want to do that because you're going to want to run the simulations, and as Peter says, check that the results are the same. Don't take our word for it, please do that. And then what you would then do, I think, to really understand the paradigm is reduce the assets that are created on a legacy import, because the legacy import won't won't sort of compensate and reduce the number of assets. It can reduce the number of compounds, so you won't get a compound per drug record, for example, but you'll you'll get formulations and dosing schedules, all the things that were repeated in the current version will be repeated in GPX. So then if you go and kind of configure the database and reduce it down to the new paradigm, you really get a sense of it. So I would say start from scratch. When you're comfortable with it, do a legacy import. And when you've done the legacy import, reduce the assets to make it as efficient as possible, as if it would have been created from scratch in GPX. So that would be my advice. And the way it's designed with the vertical workflow, it's very easy to do that in terms of reconfiguring and reducing the assets. You kind of work down renaming and then work back up from simulation, deleting the assets. And that works perfectly.
Thanks, Neil. And I think that's a big thing to highlight, isn't it? That, you can take your projects from historical VB version, classic, whatever we're calling this. We've come up with lots of names during this webinar in its own, I think. But we can take the old projects and bring them into GPX. So you don't have to start from scratch, but we do think it's a good idea when you're starting out to learn that way.
Yeah, I think another, I've
sorry.
cut you off there, haven't I? Sorry, we've got another question is, can you go backwards? So what you can do or should do is you should use GPX. It's much more efficient to do your thinking. But say if you had to go back, why would you go back to the Visual Basic, the older legacy? That may be if you're working on a specific additional dosage route. So if you're doing that, then I would take the learnings and then create the database in the earlier platforms with only those records that you need. So you can't import a GPX project into legacy. We're looking forward, we're not looking backwards, but you can create databases much quicker by creating the projects in GPX, learning, and then it wouldn't take you very long at all. I nearly put a time limit on them, but I didn't. It wouldn't take you very long at all to create a Visual Basic database. And we've got folks that have done that internally, and we, of course, can advise on that if that is the route that you're taking. Notice I said route there, additional dosage routes. There's a link.
And I think that was just to explain that the additional dosage routes are not in GPX currently, but we're looking at getting those in as quickly as we can for future releases. There's a question I think might be come back and listen tomorrow to find out more from for additional material, but a question on any other training materials available and where to find them, sort of already accessible videos. So I guess there's a lot of training that's going to come up. And as I say, Natalie is going to present on that tomorrow. I believe there's a number of YouTube videos which Neil and the team have been preparing, which will take you through those and will be available very shortly for you to view.
I think some of them might even be available now. So and we're releasing them as they're being recorded. So we've got those, we've got the tutorials as well. I can't stress that the value of those tutorials, going through those at your own pace and learning the software. And so we've supplemented the already extensive list with many more showing off the dosing schedules, the physiology schedules. Coming back to one of the questions, what can you do in GPX that you can't do it in Visual Basic? There's the simple absorption modeling that we listened, you asked for it. So you can model without the ACAT. We wouldn't necessarily advise that, but we have new tutorials covering all the new functionality, the batch simulations, the polypharmacy on the DDI, which you can't currently do in the current version.
And if I can just add one comment on the documentation piece, we've also made a pretty significant investment in reimagining the documentation. For those of you who have that experience with Legacy GastroPlus, you know it's one document that is 700, 800, 900 pages long today. And what we have done here with the GPX release is split up the sections into bite-sized chunks. So there is now, as Neil has referenced, a dedicated tutorials guide. There is now a separate dedicated equations guide, which does a really nice job of, in the spirit of open science, being fully transparent about all the equations that go into calculating the various mechanisms and models within GastroPlus. And then there is the dedicated principles guide and product manual. So you'll now be able to go to very specific documents to get exactly the kind of information that you need. So that's also going to be available here with this release.
Great. And I think we're coming towards the end. There's probably a few questions we didn't get time for, but we will follow up with those individuals afterwards. But thank you all for submitting so many questions that have been great to talk more about GPX. So I'm going to pass back to Jasmine now just to close out the webinar. But thank you all for joining us for the release of GPX.
Thanks, Peter. So I just wanted to thank everyone again for any questions that we were unable to answer live today. Someone from our business development team will reach out to you with answers following the webinar. We also invite you to learn more about GPX on our website. I'll put a couple links in the chat, links to our tutorials, links to our upcoming webinar can be found there. And then this webinar has been recorded for playback and will be available on our website and YouTube channel. This concludes our webinar for today. Thank you, everyone.